Oh, thank you, Sue. That's lovely. Nice introduction there. Yeah, thank you very much for having me. It's lovely to be invited along, particularly now when, we're not going to conferences and seeing everybody, and we do those
Mm.
fantastic catch-ups and we do networking, and yeah, I'm missing those times. So this is great. It's great to be talking to other midwives and others that are really interested in maternity services. It's wholesome and it's good for us. It's nice to know people are out there and that there's lots of us that care about what's going on. So yeah, so I was asked to talk about continuity of carer. I'm currently working, as you quite rightly said, in Newcastle. So yeah, I'm at Newcastle upon Tyne, and we're in our LMS. We've got two neighbouring LMSs that we work together, three of us together. So we're all tightly bonded together. But anyway, I guess what I was going to start with really is that we're 4 years down the line, and it doesn't feel like 4 years down the line, really, does it? Because it's gone really fast. But I'm still quite surprised when I'm going along doing staff engagement. I'm always surprised when I hear that there are midwives that think that continuity is like continuity of care is a flash in the pan. I'm always really surprised by that because I say to them, but you don't think Auntie D is a flash in the pan, do you? Auntie D is not a flash in the pan. You know, how can you possibly compare the two? I said if you had a medicine or something, a prophylactic that you knew was going to do some good and you had all the evidence for it, what would you do with it? Well, we would give it. Well, you mean like you give Anti D? You mean like you might do some antibiotics? And well, yeah. There's absolutely no difference. There's no difference between if we have a medicine in a syringe as midwives and we've got continuity of carer because all the evidence is there. It's unthinkable. And of course, the rationale behind why people are finding it a larger obstacle is it's because it's a cultural change. And I think we really need to focus on the fact that it's a cultural change for us. We get some of the midwives who've worked previously, historically, they worked around change and childbirth and they worked in teams. And again, we have to say to that, we've got the evidence around how we introduce it. We've got the evidence around the numbers, the way that we can introduce it to make it sustainable. So this level of engagement is, it goes on all the time. It's for me, it's a daily conversation. But anyway, so what's happened with us? Well, clearly the pandemic has put a cavern in where we were at, because we had I remember Jackie Dunkley Bent saying when we first started, she was saying those that can encourage those that can to try, and we'll encourage those midwives and they'd be innovative and we'll go with it. And she was absolutely right. We can see up and down the length and breadth of the country, we've got these innovative midwives who are the ones who are willing to give it a go, and they've given it a go and they're amazing. They've got amazing stories, amazing successes, and the pandemic hit. So I firmly believe if the pandemic hadn't have hit, we'd have had a ripple effect from those that had introduced models that were successful in terms of safety for the women and in terms of job satisfaction for the midwives. So I do believe that like it hit like a meteor and it paused everything for everybody. And so that ripple effect, that engagement effect, which is probably the most effective, because if your neighbours and your colleagues are being positive and have positive outcomes, that is far more effective than any engagement I can do with you. So having said that, that's where we're at. We need to rethink about how we engage, and it's no mean feat. And I know there are implementation leads up and down the country as well. And we've tried lots of different things, but we needed to think a little bit left field. So what I thought was, initially we'd been talking at the LMS about maybe we could do a film between the three of us. There's implementation leads in all our provider trusts. We thought that would be quite good. Pandemic hit and that kind of stalled it. But actually I got to where I was thinking I need to get face to face with the midwives. I need the neighbours to come and tell us what we're doing, but I can't do that. I can't have socially distanced premises. We don't have anything big enough for big days out. We we can't really facilitate huge study days. You know, we're in the middle of a pandemic. I can't really justify saying, can I please take out my midwifery workforce to come along to these events? So what I had to do was think differently. So yeah, films, brilliant idea. Take them to the midwives. If they can't come to us, we'll take them to them. Take all these speakers who can't physically come and ask them to do some films. So we have a saying up here, and that's shy Ben's getting out. So I just thought, right, you know what? I've got some great colleagues up and down this in maternity. I've got some fantastic colleagues. I'm going to ask them. I'm just going to ask them if they'll do us some films. And I cannot tell you how overwhelmed I was with the response, because everybody was really positive about it, and everybody said, "Ooh, yes. What exactly do you want me to do?" So I say, what I really want is something really positive. I'd like whatever you can give around implementation of continuity of care, what an experience you've got, even if it was like, hello, we're right with you, we can't come and physically see you, so anything you can give really. And I have to say the response was stupendous. So I know that my colleagues want to know what the neighbours are doing, because I like to twitch my curtains and know what my neighbours are doing. And I certainly want to know what my neighbours are doing in terms of my professional capacity. So whilst I knew, because I have got my leads and my contacts in my local providers, I know that the midwives on the shop floor and the MSWs and the obstetricians, they haven't really got a handle on what's going on, and we needed to showcase it. We needed to spread the word. So I think if we get opportunity, I will send you the links with some of the films, but I would absolutely need their permission before sharing them, and that's why I haven't shared them tonight with you. So I will individually go and ask the contributors if they would agree to it. So that's why I'm not sharing them with you tonight, but I will ask. In terms of contributors, excuse me, we had Sarah Wall, who is our MVP service user rep for our LMS, for the Northern LMS. And Sarah gave, excuse me, a marvellous feedback in terms of what she'd got from service users. So she'd done a survey and she was able to feed that back. So the midwives were able to drop in and see that and hear that. Trixie Macari gave us absolutely fantastic, really upbeat, supportive video. And that's, you know, that's great, because she's new to us, and it really forged that beginning of that relationship. And I know it's going to be a relationship that's just going to go from strength to strength. It's about reducing that gap between the shop floor midwives and our national team. Absolutely, it really does that. It brings it back in, it makes it personal, and that was really important. In terms of our neighbours, Lucy Findlay, who's me, but down in South Tees, did an amazing video for us. And I know that our midwives loved it, because what they really wanted to hear was the nitty gritty. You know, what models have you put in? How many midwives were you doing it? Whereabouts are you doing it? She can relate it to places that they know, that they're familiar with. And actually some of our lot lived down there. So that was really great. Anita Scott, who is the North Tees lead, did a fantastic video about their single point of access. So this feeds in brilliantly to Better Births around, you know, it isn't just about continuity of carer. There's lots of work streams within it. And their single point of access was really interesting. Our lot obviously compared it, you know, our lot go through, our midwives get their women booked through GPs, that's their referral. So it was really interesting for them to see, you know, everybody does it slightly different somewhere else. So that was really great for them as well. They got to know about that. Up in Northumbria, just up from near where I am, the Bright Beginnings team, and they have a team, a continuity care team that's based in Ashington. It's an area that's got high deprivation, and they're seeing great results. So for my staff to see that, because it is really close to home, really it gives it a tangible reality about what's going on, what's happening with the neighbours, what can we do. So that was really good. And then the fantastic Catherine Hardy, who is our programme lead for LMS. I have to say her video is so brilliant. She has gone through changing childbirth. She did, the pump prime money when we introduced teams back in the day. She's gone through all that. So she's got that credibility. She absolutely is a practicing midwife, so she can give that credibility around the research, the rationale as to why we want to do it, and then she moves it on further in her video around professional responsibility. It absolutely superb, as she covers all aspects. So for me, Catherine's video is the jam in my sandwich of montage of videos. Catherine talks about in that video about what we're doing as a region. So as a region, we've got our layer as providers where we're doing continuity of care, and we're implementing individual aspects around that. We're all doing something slightly different. But underneath that, behind that as a region, we've got a piece of work going on, which is us looking at it from a regional perspective to see what we can do about implementation from a regional perspective. So very much about blue sky, blue horizon, looking around what can we do in the future to make it a sustainable programme. And, you know, in the future, we're thinking around cross-boundary working, we're thinking around shared guidelines. Obviously, things like the network, we already look at safety and shared guidelines, but this is a serious piece of work that we've done hours and hours of observations in all our providers. We've gleaned data around when births happen, what the use of midwives' time is. It will come as no surprise to anybody about how midwives use their time around use on admin, travel, and so on and so forth, and actually how much time we actually spend with our women. So it's a huge piece of work, which is going to help us inform the background to what we're doing. But anyway, I'll bring you back to my films. So the rationale behind having all these films is that the midwives are able to just drop in during the course of their day. If they've got a coffee break, they can drop in and they can see it. I don't expect them to come for the whole day because that's unrealistic, and I'm taking the videos out to the community basis as well. And so really it's a case that they can do bite sizes. They're not going to have to sit through the whole day, and I'm going to be able to do it on a repetitive whole month. So I called it Oktoberfest, but in reality it's going to be Novemberfest, it's going to be Decemberfest. I just needed to make it accessible. I needed them to know how much great work was going on. They needed to know what the neighbours were doing. They need to know that it's successful. I did put in a load of the YouTube videos from our national friends as well. So South Yorks and Bassetlaw, Hull, who are our buddies, I put in one of theirs. And I'm really able to tailor it. So when the midwives come, they go, oh, I really want to know what the midwives think in Hull. So I go, that's great, I've got them, I can show you that. Oh, I really want to know what's happening in Sunderland. I want to know what's going on in Darlington and Durham. And I go, well, that's great, because I've got Amy Matthews who can tell you all about it. So it's worked really well as bite size. It is perhaps an unusual way to get to the staff, but I would absolutely recommend it. I haven't got to all my staff by any means. I'm going to be mobile with it. I'm going to be going out and seeing them, and hopefully getting the message out there that it's good, it's completely evidence-based, it can be good for you as well as good for the women. So yeah, that's my experience around trying to promote continuity of care in COVID times. You've got to do something slightly different. So that's kind of where I'm coming from. I could talk to you all day about it, so honestly I haven't even scratched the surface of what we're doing. There's so much good work going on. But yeah, that's where we're at now. That's where we're headed.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.